So I am going to get started. How about that? Because if I don't, I'm going to get older, and that will fit right into the subject, right? So tonight, this is an MS Conversations Now, Patients' Voices event. It's a series that we began, well, probably towards the end of 2020, okay? And it is me always speaking with an MS patient that is doing something in their professional life as or for the MS community. Tonight, we have Cherie. Cherie is a MS nurse living with multiple sclerosis. For the past several years, she was on the research committee for I Conquer MS and headed up their Aging with MS work group. She's also an advisor for the National Aging Initiative for older adults living with multiple chronic comorbidities. Now, Cherie, because you have so much to talk about, and we're not going to really be doing a talk, where you're presenting tonight, but it's going to be more that I'm speaking to you, you're speaking to me. I'm going to ask you questions. People are going to send in their questions, and we're going to talk about different things to do with aging, all right? So why don't you tell us a little bit about what it is that you have done or did do with CMSC and I Conquer regarding aging with multiple sclerosis. You got 5 minutes. 5 minutes.
CMSC is the Consortium of Multiple Sclerosis Centers. We got to be careful to not talk in alphabet soup when people might not know what's going on. And I think all of us that kind of are immersed in this sort of thing tend to do that. So if you that are listening to us hear us refer to anything by initials and you don't know what they are, don't hesitate to ask. The Consortium of Multiple Sclerosis Centers has been in business for probably the last 30 years, I would say. And it's a coalition of MS centers around the country and Canada, and also neurologists, nurses who are MS certified nurses, rehab specialists that work with people with MS. And they do an annual conference every year. Last year, we did focus on aging in MS. The next conference is going to be in October this year in Orlando, provided we're not going virtual again at that point. But the aging with MS component that they shared with us last year, we'll get into a little bit in our discussion today. First, though, I just want to take a moment. I hear people all the time saying, is this my MS or is it just part of the aging process? And I have to say that this is a relatively young field of research, aging with MS, because until the advent of the disease-modifying therapies, or DMTs, as we like to refer them as, we had a much shortened life expectancy because we were tending to go downhill rather quickly. At the time of diagnosis with MS, 85% of people had relapsing remitting MS. And the other 15% probably had primary progressive. They were saying up until the late 90s, early 2000s, that the natural course of the disease had us transitioning to secondary progressive MS after about 10 years. And we're not seeing that with the disease-modifying therapy. So we're seeing people age better, live longer, live healthier. And I think that we can all expect as we age to have regular signs of aging hit us. Things like changes in hair color, changes in skin texture, even changes in dental health. Those of us especially that have had steroids are going to see perhaps tooth loss. We're going to have more crowns in our head, that sort of thing. Those are maybe MS enhancements to aging. MS may have predisposed us because of some of the medications we take, not because of the disease process. As people age, they generally end up with what we call comorbidities or other conditions other than MS that they're living with. The average person with MS who's over the age of 50 usually has at least 3 or 4 MS plus something like diabetes or hypertension or obesity. Now, those are things that our steroids that we use to manage relapses all make worse. So I think the intent is to modify our lifestyles so that we're not allowing those sorts of things to sort of come in and impact the aging process. So as Stu and I talk, if there's anything that you want to ask us, just write it down, take it into the Q&A.
Right. So that's what thank you for giving your little update at the beginning. Now I forgot to tell everybody, all right? Yes, there is at the top of the scroll bar on the right side of the screen, those that have been on here all the time, of course, know. For anybody that's new on here, the rectangle that's orange or red, I can't tell the difference, with an arrow in it, click on that, type in your question, send it off, and we'll include your question with the program. Now, for anybody that asked any questions tonight that might have been on last night's call with Aaron Boster, I'm just going to remind you, though, what he answered, concerning that. Like Mike, I mean, I don't know if you wrote it last night or somebody else did, but the question is age, MS, and DMT, should we continue or not? And Cherie, I'm going to let you answer that in a moment, but I'm going to tell you what Boster says. If you're dead, you can stop. That's it. If you're dead, you can stop. There's no reason for you to use the medication if you're dead. But until then, you should keep using the medication. So, what is your opinion?
My opinion is based less on research and more on personal experience. I stopped a DMT when I was over 60. I had heard that people over the age of 55 or 60, their immune system slows down, so it tends to attack itself less. And we may be able to, if we've been stable, get off of our medication. That's an if we've been stable for at least 3 years. There's no relapse, no worsening in condition. Stu, you wanted to interject something.
Well, I do, because I want to say that I disagree with you only because you may stop the medication and then what? What if you get worse while you're stopping?
All right. I said that was the reasoning that I had been told, not that that was my decision or that that's what I thought was true. So I do not think that that's true. I know plenty of people in their 70s and 80s who still occasionally will have a relapse. I went off of a medication. I had been on Cytoxin for a couple of years, which isn't used very much anymore, but my doctor felt that where I was warranting that. So I was on a relatively high dose of Cytoxin every 2 to 3 weeks for a little over 2 years. Really hard on the system. But when I came off of it, I was 62. And my doctor told me that it was highly unlikely I would ever need to be on another MS medication again. 7 months later, I had the worst relapse I'd had in 20 years. So I went back on a disease-modifying therapy for another 4 years, went off for 6 months at his recommendation, relapsed within 3 months. So I know that now that I don't believe I'm a candidate to go off of medication. I agree with Dr. Boster. I heard what he had to say last night, and I totally agree with him. Unless you've really got a patient that is medication fatigued, they haven't had any sign of disease activity ongoing on their medication for at least 3 years, my doctor says he wouldn't even consider it unless it had been at least 5 years without a relapse. Right. But if you've got them that have been on that have been doing that well, and they're really insistent on coming off of medication, it may be a decision that you make with your doctor, but your doctor may want you to see him or her every 3 months instead of every 6 months to a year during that time. They may want more frequent MRIs to track the progress. There was a journal club that was done on this topic by the Consortium of MS Centers, maybe just about a year ago. And the nurse practitioners that were presenting the research said that one of them had, in his practice, he had an 83-year-old woman who'd been on Avonex for more than 20 years. And she'd been stable, hadn't had a relapse. She came off the Avonex, and he said, the first MRI that I did was 5 months after she came off of her disease-modifying therapy, and there was already new lesions, so we had to put her back on. She had not felt that she was relapsing, so the changes in the brain were seen before the symptoms arrived, but they dealt with it quickly. They didn't want any damage to happen.
Okay, thank you. Before we go any further, there have been a lot of people that have signed in since I first opened up the program. I want to let people know that I'm Stuart Schlossman, and I am an MS patient, president of MS Views and News. We do this program, MS Patients Voices. We do this once a month where I sit and I speak with a person or two people at a time, where the other person has got multiple sclerosis and is very involved with working and doing things for the MS community. Our guest tonight is Cherie Binns. Cherie Binns is a nurse. She's an RN, okay, and she's a certified nurse with multiple sclerosis. And so we're just speaking about aging. And when I speak about aging, I mean, wow, aging with MS, wow. I mean, aren't we all aging? Give me a break. This conversation doesn't have to be for 60-plus-year-olds. What about those that are in their 40s and wondering when they're not going to be able to see clearly again? And speaking about seeing clearly again, so many people think that, oh my gosh, my eyes are getting blurry. Is it MS? Okay. Where do we go from there? So again, we got to look at the age groups, right? I mean, their eyes could be going blurry reading just because they turned 40. Or 45 or 50, and now they're needing readers, okay? But that doesn't mean that it's MS related. So, Cherie, what do you want to say about that?
A lot of changes take place normally at certain stages in our development. The reading glasses is an excellent example. Most of us by the age of 40 or 45 have something developed called presbyopia. We are going to need some assistance to read more clearly. That's not MS related. Even if you've had optic neuritis several times and your vision isn't the best, I'm missing segments of vision in my left eye. That doesn't change the fact that I can't see as clearly as I used to do fine print reading or to do fine sewing work, anything like that. I need to augment it with some glasses. Things like bone thinning. All of us tend to lose bone density as we get older. By the time we're 55 or 60, most of us have thinner bones than we did as teenagers or young adults. If we've had steroids on board, that speeds the process up. So it's important that we do preventive healthcare, such as a bone density scan every couple of years, just to keep track of that so that we can manage it. Our vitamin D helps us to keep our bones a little bit stronger longer. And we're seeing, a lot of things that have come out of aging research are helping us to age better as we get older with MS. Back when I first started nursing, the statistics were saying that the average person with MS had a much shortened life expectancy. I think at the time, healthy people had a life expectancy of around 72 or 73, and people with MS were about 58. We now have a life expectancy in the healthy population of mid-70s. For women, I think it's 78, and for men, I think it's 74. The average person with MS is now expected to live at least till 72. So, and I think the disease-modifying therapies have helped us to get to that point, 72.
Wait, I can't hear you. Is that MS related?
Do you have a ringing in your ears? That may
That's
be
right.
that may be MS related, the ringing in the ears, but the diminished hearing is not generally, unless you have lesions that are impacting your auditory nerve, which generally they don't, because the auditory nerve is not in the brain. It's at the brain stem, and most of us don't have brain stem lesions. If we do, we probably have a very serious form of MS that's causing things like cardiac irregularities and severe hypertension, high blood pressure, things like that. But brainstem lesions are extremely rare, and those that have them generally have more complications.
So then I hear from people, oh my God, my teeth hurt. Well, guess what? My teeth hurt too. But I also have trigeminal neuralgia, and that is MS related. Okay. And, but I have other problems with my teeth that, well, guess what? Yeah, those are old teeth in my mouth that just needing a little aid to get things going along here, right?
Right. I think, in the course of the first 2 years after I saw the neurologist that I'm seeing right now, I had 38 grams of IV Solumetrol in a 24-month period. Part of that was for pain management, but he also was a proponent at that time. Remember, we didn't have, I didn't tell you when this was, but I started seeing him in 2001. And it was at the time I started seeing him, there were only 3 injectable medications on the market. And no other doctor had put me on medication because I'd been symptomatic since 1975, and the medications were tested to be effective for those that had had MS for less than 5 or 10 years. And so they felt that I'd had MS for so long that none of the medications would really help. Well, this doctor didn't go along with that. He put me on a medication in 2001, but because my symptoms were so significant, because it felt like I was in a constant relapse, that one relapse was piling on top of another, he put me on pulse steroids every month. So I had a dose of steroid every month, plus 3 to 5 day courses, maybe 2 or 3 times a year. So I had quite a lot of steroids. 2 years after I stopped the steroids, I started breaking teeth. So I've got a mouthful of crowns. And I started breaking bones. I think I've had more than 70 fractures since 2005. That has been brought under control with medication and with vitamin D and things like that. Exercise helps a lot to maintain bone integrity. Walking particularly is very, very good to keep your bone density up. Anything that's weight bearing. So.
All right, I have a couple of questions from people. I have several, but I want to start asking that, and then we'll get back into what I have here on paper to discuss with you, right? And so Maria is asking right now, is pulsatile, probably saying this wrong, pulsatile tinnitus associated with MS?
I'm not sure. Can you spell that?
Pulsa, P-U-L-S-A, tile, pulsatile. Pulsatile? I don't even know if, Maria, can you retype that word, please?
Read the question again, Stu.
Is pulsatile or pulsatile tinnitus associated with multiple sclerosis?
Not that I'm aware of. I really can't answer that question.
She wrote, yes, that's the spelling. Okay, am I saying
all right,
wrong?
So if it's tinnitus may be associated with MS, but it's not necessarily the only cause of tinnitus.
Right.
Or ringing in the ears.
Okay, so, yeah, she said that I was saying it right, and she's good with an okay, so we'll go forward from there. Mike wants to know, does this change if you're, well, I don't know where he was saying it from, but he was saying, I guess when we were talking about aging and medications and whatnot, does this change if you're PPMS versus relapse remitting, as far as when using the drugs and when you can quit?
No. If you, we didn't have drugs for PPMS until Ocrevus came on the market.
Right.
And there are others in the pipeline right now that may be available in the next few years. But if you've been on a medication with your PPMS that has stabilized your disease, you're not going downhill as quickly, I think you want to stay on that medication as long as you can. Because likely once you come off, you may have some rebound disease. There may be some inflammation that kicks up that wasn't bothering so much while you were on the medication. So I would stay on medication.
Great, thank you. By the way, thanks everybody for being online tonight. We got a lot of people on here. That's great. Okay, I'm hoping that not everybody's over 60 because, like I said, this topic, aging with MS, is good for anybody. That's, well, since you were born, you started aging. And actually, it came about, though, when you got multiple sclerosis. So that's when you were aging with MS. All right. So next person, Kenneth, is writing, does our immune system slow down as we age?
Generally, yes. That doesn't mean that if you're very susceptible to inflammation in your central nervous system, that it's really going to slow all that much. Those triggers are still there, and your body goes into overdrive. It automatically tries to get rid of threats. And it gets very good at that over time. So it's learned over time. And
Right.
and I think your immune system may slow down on some things. You may not get colds as easily, things like that. Or you may get them much more easily because the immune system isn't going into higher gear to attack the viruses that are coming at you.
Yeah. What about itching? I mean, I'm always itching, but I was told it has to do with my MS as well. But will it get any better as I get older?
I don't think so. I think we become used to those, I like to call them noxious stimuli, the itching, the burning, whatever. When we first start experiencing it, we feel like they're awful. But then we get used to it and we learn to deal with it. And I don't know that it always gets that much better. It's just that we've become used to it. We've learned to live with it. And I think, those sorts of things, itching is always worse in the winter, but I think that's dry skin being added to things. So moisturizing helps.
Itching is not always bad in the winter. It's bad in any dry climate. When you're coming from Florida, a very wet climate, and going anywhere just about in the United States except along the Gulf Coast, I notice a dryness, so it's difficult. All right, Kay is asking a question that I surely cannot answer, and I'm definitely going to leave it for you. And this is, did you notice a change in your MS after menopause?
Yes.
I can answer it.
Yes.
Good or bad?
I think that it got better. It felt to me like I wasn't struggling as much, but I also had made some lifestyle changes that may have impacted that. I had eliminated sugar from my diet, and that makes a huge difference in inflammatory responses, in fatigue, in energy overall. But certainly after the ovaries stopped doing their job, stopped pumping out estrogen, the headaches definitely got better. In fact, I haven't had a migraine since I went through menopause. And they were pretty frequent prior to that. They were always, it was like when I would relapse, I would have almost a constant migraine with the relapse, with visual disturbances and nausea and sound and light sensitivity, pretty constantly. That hasn't happened since menopause. So there are a lot of people that do say that menopause seems to make their symptoms better. One of the things that they said at the consortium meeting last year on the Aging with MS was that once a woman has gone through menopause, her disease progression tracks that of men. So women tended to stay sort of on a curve a little bit above men, while men were kind of going down. And once a woman hits menopause, their curves join and they progress at the same rate, provided they're not on medication. If they are on medication, men and women tend to level off and go more evenly through those years after mid 40s to late 50s.
Okay. What about for those over 50, all right? If they've never exercised in their life and they want to get started on exercise now, or even if they're 60s, do they have to be afraid of what that could do to their bodies, or should they just be delighted with it and do whatever they can?
Do what you can. I sort of dipped my toes in the water of the exercise arena after I broke my foot severely and it just wasn't healing, and was told that water exercise might be the best thing for me. So I just got in the water and I started doing things. If I would move a certain way or try to adapt a floor routine to the water or stretches or whatever, I just listened to what my body was saying. I took things slow. If something didn't feel right, I didn't repeat it. I recommend, though, that when you're getting started with an exercise regimen, you get a physical therapy evaluation visit and let them know that you're looking to start a home exercise program and where do you begin. And they'll help you with some simple exercises and work to build that up. There are also the MS Association of America has a great exercise program for water. The National MS Society has some good pamphlets on where to get started with exercise, as does the Multiple Sclerosis Foundation.
Right.
So there's plenty of resources out there.
You can listen to me just tell you to go find somewhere to exercise, even if it's on your own living room, especially during COVID, okay? It's great ways you can get online. We have so many different personal trainers and physical therapists that we've had doing virtual programs for us, like Gretchen Hawley, who does this twice a month for us. You could easily get online during one of those programs and watch what can be done, all right? Now, Yvonne has a question. I don't know if you could answer this, but she's asking a question about, can you explain anything about old lesion? I don't think that that's really a topic for tonight, but yeah, exactly. So, Yvonne, this is a topic for one of our MS neurologists or nurse practitioners when they're online. This is not a question for Cherie Binns, all right, and definitely not for myself. Not unless you want to talk about the American Legion. Then I'll talk to you about that, all right? But that's about it, all right? Or the Moose Lodge or something, okay? We can do that. All right, next we have Mike is asking brainstem lesions. Can that cause AFib? I don't know what AFib is, of which I have both.
Atrial fibrillation. Atrial fibrillation is a very common condition as we age. Many people over the age of 55 or 60 are going to have atrial fibrillation. I do not believe it's associated with brainstem lesions.
Right. So I was reading it as initials for something. I didn't know what. We're talking about the American Legion and things. I was reading AFib. All right, yeah. I was diagnosed recently with supraventricular cardio something.
Cardiomyopathy?
No, tachycardia. That's what it is.
Tachycardia.
SVT, supraventricular tachycardia. And yes, that has nothing to do with MS, but I still have to take pills. All right, so too bad. All right. Cindy is writing, my migraines with aura started at age 30. Come to find out, had nothing to do with MS. It was because of here's letters, a PFO, whatever, a small hole in my heart.
It's a heart condition.
Right. A small hole in my heart. Offering this simply to support your plea that not everything is because of MS. Thank you, Cindy. All right. So another is that, people are asking about more to do about the exercise. Where could they feel that where it's safe for them to begin? Is the stretching and the strengthening that they hear about so often, is that a great place to start? And,
it is.
Or should they just be going all in at a later age?
I would start with stretching and strengthening. If you have spasticity at all, you should be stretching every day, multiple times a day. Just even for a minute at a time. So if you've got spasticity in your legs, you should be stretching that out, holding your stretches for 20 to 30 seconds at a time. Same with your hands. If your hands are cramping, just, stretch them and hold that stretch for 20 to 30 seconds. That's going to help the spasticity. It's going to help the muscle tone. It probably, in the long run, is going to help you to sleep better.
Right. Okay, thank you for that. All right, so caregivers. Yes, if you have a caregiver and they're living with you, then yes, you could say that that caregiver is also aging with MS, all right? And they could be doing everything alongside with you, all right? It's the same thing. Remember, it's a family thing, so get them involved with doing what you want them to do, and maybe it'll be easier to do things like the exercise programs or playing Scrabble or playing anything else to get, do mind games that are for cognition. So let's talk about that for a minute. What do you want to tell us, Cherie, about mind games? What can you do? What can you do to help keep the cognitive aspects going instead of that declining as we get older?
I think something like games that are sort of rote sort of things, like maybe something like Mahjong or Solitaire, aren't as helpful as something like perhaps a crossword puzzle or things that are logic sorts of games, because they make you think. If you're just sort of into doing something mindlessly that has nothing to do with preserving your cognition, you have to challenge your brain. I think that, learning a new skill is really helpful. Taking music lessons, joining a book club, getting into discussions with people where you're not just sitting there listening passively, but you're actually engaging. You're thinking through a process. I make it a point to do at least one continuing education module every month, minimum. Sometimes it's 4 or 5 a month, because I find that I'm sharper and I feel better about myself if I'm learning, if I'm learning new skills, if I'm learning new things. So the mind games, there's limited evidence that they really help all that much. I think learning skills are more helpful than games.
Okay, that's great. So if anybody's on, Internet Scrabble, bring it on. That's all I'm going to say is bring it on, all right? I play 20 to 25 games a day, all right, with different people, and just bring it on, okay? By the way, I did for a friend of mine that does cognitive testing. I wanted to see what the cognitive testing was about. So I had him send me the test. It's a psychological exam. And oh my God, I took this morning. It took me 40 minutes to do, which it's supposed to do, but it had all these different numbers and different shapes. They had to match shapes to be with other shapes. Well, you had to remember a series of numbers, and they start you off with just 3 digits. They get up to 8 digits. No, I couldn't remember where they were supposed to go. I felt like an idiot doing this thing. I really felt like, wow, 3rd grader could probably do this really, really well, but it's not working out for me. But yet I found out afterwards that for my age, I was very average. So I felt so much better. But, I said, well, that's still terrible, though, because that means I'm not as smart as a 40-year-old. Okay.
We do tend to lose IQ points as we get older. That's a very normal process with aging. If you had an IQ of 130 when you were in college, your IQ at the age of 60 is probably closer to 110.
Wow.
So we do shed some points on IQ. So that's why it's so important to keep learning.
Sure. So, okay, going to other things, though. Going to other things that are symptom related. People want to know about losing their taste as they get older. Is that MS related, or is that just a part of aging? Taste, smell?
I think it's more a part of aging, taste and smell, unless, of course, you've been exposed to COVID or had it. Yeah. But no, our taste and our smell, our hearing and our vision all diminish. Our sense of touch tends to diminish. We don't realize necessarily that we're losing that tactile sensation, the ability to feel whether something is smooth or slightly rough. That's a normal aging aspect. Our senses diminish over time. That's not MS related.
Right. So I had a scary thing happen to me a few years back. I was never able to feel with my left hand, fingertips. I mean, that goes back to when I was very, very young. And then one day I reached for a cup of coffee and my hand, all of a sudden, it scared the crap out of me, literally, all right? I mean, not literally, but it still scared me a lot. I felt something in my fingertips that I had never felt. I felt the searing heat of a coffee cup coming out of a microwave. And it was like, wow, what was that? And then I learned that, well, that's the same thing I feel with my right hand. But all of a sudden, I was now feeling this with my left hand. And, that goes in and out. I mean, I was fortunate to have had it for a few weeks, having a full feel. I got to experience what things felt like with my left hand, but I've lost it again. But it's still, I still had that experience that was there. But yes, that's an MS-related thing.
That's not an uncommon sense to have happen. I, for years, did not feel much in my left leg. That was the foot that I broke, and I didn't need anything with more than 30 fractures in my foot. I didn't need anything more than ibuprofen for pain because the sensation was diminished. However, getting onto a more effective disease-modifying therapy than what I was on, it began to heal back, and I feel normal sensation in that foot again. So having, I think sometimes our disease-modifying therapies can help some of those sensations normalize because they're calming the inflammation in the central nervous system.
Right. So another thing now, lifespan with MS. So for many years, everybody was told, you're not going to live till, as much as a family member or somebody else that your own age. But isn't it true that as long as you're using a DMT, that you should be living a normal, healthy life?
Yep, it is. As long as you take care of yourself, as long as you do things that preserve your sense of well-being and your overall health, things like eating correctly, things like exercising on a regular basis, tending to your spirit, faith systems. People who have a faith system tend to live longer. They tend to live better. Volunteerism, working for as long as you can. I see too often people who retire going downhill very quickly after they retire. They lose a sense of purpose. And the same thing is true for those of us with MS. I was, by necessity, out of the workforce for several years in my 50s. But I'm going to be 69 in a couple of weeks, and I'm back working as just about as full time as I've been in a long time. So
that's really, really good. And I think people ask me, are you ever going to retire? And I say no. Why? How much golf can you go out there and play, or go fishing, or whatever? And it's not that I'm a multimillionaire that I could just say, okay, let me travel the world for the rest of my life. It's not going to happen. I enjoy working. It keeps me busy, keeps me occupied, keeps my mind stimulated all the time. And I can do my 18 hours a day working and not have a problem with that. So, it's like my own form of exercise, being able to do all this. But, I try to tell people all the time that it's probably better to continue working than to, like you said, you sit back and you stop, you give up on everything. And then what? You get depressed. And well, nobody needs depression like that either.
Yeah, I think COVID showed us how depressed we can get when we don't have our purpose, when we don't have our routines.
Right. So speaking about COVID, though, for a second, a lot of people talk about the isolation. All right. The isolation that they've been in with COVID for many. And I've had many MS patients write to me and say, I've been home for so long because I can't go anywhere and I don't have family around. I've lived that isolated life for the last 10 years. I'm not doing anything different. Now you all know what I'm living with. So what do you do and what do you say for a person, though, that is, now complaining because they are getting older, they are living with multiple sclerosis, they're afraid to go out in public, although
I think we lost Stu.
What? Can you hear me?
We can hear you now. You froze for about 20 seconds.
Really? Must be the weather. I'm having a thunderstorm. Okay. Can you hear me now?
Yes.
Great. So maybe it was your end. Can everybody hear me? Wave your hands. Oh, I can't see you. Don't worry about it. All right. So I already forgot what I was saying. I have a mess and I forget. Basically, though, it's for people that are, isolated and have been isolated and getting depressed and not knowing really where that depression is. Is it being caused more by their MS or is it being caused by social conditions?
I think it's a double-edged sword. Certainly, if you're isolated, you're far more likely to become depressed. And again, it's that whole focus on keeping yourself mentally stimulated, learning new things. And in today's connected age, we have so many resources that we can connect with other things, other people, other topics, just to sort of lift our spirits and fill our heads with more information, more things to process, more things to be interested in. If you find that you are sad most of the time, if you find that you're more irritable than usual, if you find that your appetite or your sleep patterns have changed, and that's gone on for more than 2 weeks, then you need to talk to your doctor and get a referral to somebody to talk to, possibly even some short-term medication to help with depression. And I say short-term because so many of us think that once we go on a medication, we're on it for life. That may be true with your blood pressure. It may be true if you've got diabetes. It may be true if you have something like atrial fibrillation. But it's not necessarily true for things like sleep disorders or spasticity or mood problems, anxiety, all of those sorts of things. So look at, when you go on to a new medicine, I suggest that people have a discussion with their doctor about how long am I expected to take this? When might it be okay for me to taper off of it? And get a plan right at the beginning so that you're realistic about your medication use.
Okay, thank you. By the way, my producer said he heard me, but that you froze.
I froze.
Yeah, you froze. How about that? Maybe that's why you couldn't hear me, but thank you for that answer. All right, so we have another person saying about being isolated. It's good to be introverted in order to be in isolation. I got it, Rick. Thank you. All right, Tamina from Canada. Hi, another resource to stimulate the brain, luminosity.com. There's a paid and free options, a lot of games for the brain, working on memory, concentration, and etc. Thank you very much, Tamina. All right, I think I'm getting to know how to say your name. I hope I'm saying it right now. Okay, Cindy is saying, as we get older, our medical needs may get more complex, costs money. Does the consortium of MS centers have people that advocate for all of us on Capitol Hill, like with regard to SSI issues? Senate Committee on Aging has jurisdiction over the SSI issues, concerns we all have or must have. Just curious.
Yeah, the consortium does, as does the National MS Society, the MS Association of America, and the Multiple Sclerosis Foundation. So they're all there advocating for a more comprehensive service. Most of us that are on Social Security disability become eligible for Medicare, even if we're not at Medicare age. What we don't tend to realize is that once we go on Medicare, and this is something that's really, it's a thorn in my side, and it's a thorn in our doctors' sides. Once you're on Medicare, your co-pays go through the roof on your MS medication. unless they're infused. Anything that's self-administered has a 40% copay. So if they're charging $9,000 per month for your disease-modifying therapy, which most of them are now, your copay is going to be close to, $3,500, $4,000 a month. There is help through foundations to get those medications, but it's not consistent, and it doesn't generally even last for a year.
Right. And last year, during the beginning of COVID, they were wiped out. I had so many people and knew so many people that just could not get the prescription assistance that they had, and that faltered because they couldn't get their medications. And so, that became a huge issue. Cindy's furthering her question or statement saying, do all organizations work together with regard to what you were just saying?
They do.
Okay, that answered that. All right, Ruth is adding, talk to a medical professional about antidepressant or anti-anxiety meds. Some people need the meds more than temporarily. And that is quite true. That is very, very true. Going a little bit further, social awareness. We don't have that much more time left. We have about 10 minutes, 15 minutes. All right, but I want to speak about a few things. Social interaction, I would say, more than even awareness. All right. So there are so many people out there that are of various different age groups that may be isolated, but through the power of the internet, you guys are right here. You're on the internet with us right now. Why can't you connect with other people? It doesn't have to be on social media, but you can connect with other people that you knew in support groups. Just tell everybody to get on with a Zoom meeting. All right. Take control. Okay. Take control and don't let yourself wither. All right. Take control. Show other people that, you want to do this. You want to make sure that you and the other people from that group are not seeing each other anymore. Get the interaction going and it'll help you. What do you say?
Absolutely. My younger daughter, when we were still isolated and couldn't get together for holidays, did a family Zoom over dinner. So we would have dinner together in 3 separate households. And I think, some of us are still that isolated, but we can take, if we can't get out of the house, we can take a page from that book and we can reach out to people. If you're on this call tonight, you have the ability to do that.
That's correct. That's very true. All right, another topic, clinical trials for people over 65. All right. I've heard, MS Views the News, we work with a lot of the clinical trial companies out there, and one of the biggest ones is Antidote. All right. And Antidote has recently told me that it really depends on not them, but who's paying them to do the work. So, there are hit and miss. There are plenty of trials out there that you could possibly be in that are great for people that are over 65 and others that are not. So it's more hit or miss, but great for the people that do want to be in clinical trials.
The MS medication clinical trials have not been tested on people over the age of 55 generally. I think there are a couple that have tested them to 60. And the reason for that is that they don't want to muddy the waters with comorbidities, with other conditions. If you have poorly controlled diabetes or high blood pressure, they may exclude you from being in the clinical trial because if you're on active medication, it may mess with those conditions. So the drug companies, there's been a lot of dialogue in the last 10 years with the drug companies, letting them know that if their medications are being used in age groups that have not been tested, there may be a sort of a liability. Not necessarily on the company because the company has said safe for people up to the age of 55. But it may put us at risk for complications. It may put our doctors at risk because of the need to basically cover their tails while still taking care of our needs as patients. So I think that the manufacturers of medications doing those clinical trials are aware that it's very reasonable, particularly if they're doing a medication for primary progressive MS, if they're doing a clinical trial for that, they need, the people with primary progressive MS are generally older than those with relapsing remitting MS. Most primary progressives are not diagnosed until their late 40s, early 50s, where relapsing remitting are often diagnosed in their 20s, 30s, or 40s. So they're realizing that it's important to start including those people. There are trials that are non-medication trials that include those of us over the age of 60, but they're generally more observational or lifestyle types of trials, like the exercise trials.
Sure, that's good. So, okay, so one of the last things is, can you please tell us, other than exercise, what other lifestyle changes can help to make or extend lifespan?
Certainly what we put into our bodies makes a difference. I mentioned sugar earlier. Sugar is probably the most inflammation-producing thing that we put into our bodies. And if we can eliminate all but natural sugars, it tends to eliminate inflammation. It's hard for those of us that are addicted to sugar because so many foods have sugar in them. Eliminating preservatives, processed foods, anything that you get that's in the freezer section that's pre-prepared, that has a combination of things in it, generally is full of things you can't pronounce. You don't want to put those into your body because they can also cause more inflammation. Many people with MS have food sensitivities that they're not aware of. I've found that for me, both dairy and gluten cause some problems. And they're not what you might think of as far as allergy symptoms. My fatigue really ramps up when I'm eating out and don't know what's in the ingredients, or when I'm at a buffet at a dinner. When we were doing live programs like this, because the glutens and dairy can be hidden in things. And I find that I sleep less well, my pain ramps up, my fatigue and my energy are just rock bottom after I've been eating out for a while. So the more you can prepare fresh, whole foods at home that are not loaded with salt and sugar and various additives. I'm not talking about spices. You could certainly spice them up. In fact, pepper is one of our biggest anti-inflammatory medications. So add some spice to your life and feel better. Now, one thing we didn't touch on, Stu, aging research has worked on a lot of these things that we can do to age better. If we start those early on in the course of our disease, we start that exercise, we start what I've just said with foods. We do that as a lifestyle change, not as a diet. And we carry that through and keep modifying it and adjusting it as we age and find our needs change. That's going to help us to live longer, better.
Okay, thank you. Somebody just came on and they asked about myelin sheath. Have we spoken about that? I just want to let you know that this is not the program for that. We don't have an MS doctor on here tonight. We don't have a nurse practitioner that's an MS specialist. So we're not talking about those types of things. This is a program that was for aging with multiple sclerosis from whatever age till whatever age. You know, we're just talking about all different things. If you just came onto the program, I'm sorry about that. I'm sorry for the storms that you had in Pennsylvania. But, you know, this will be on our YouTube channel, hopefully within a week. Right now, I'm 3 weeks behind on putting things on the YouTube channel, but hopefully we'll get it up there rather quickly and you can see everything that was on this program. I just want to, we do have more questions that are coming in online, Cherie, and I do want to get to those as well. But I want to let people know also that there's a person that asked if we're going to talk anything about the Walls diet and Swank diet. No, I don't. That's not for tonight, all right? But I will be interviewing Terry Walls on November 23rd. This was just scheduled yesterday, and we're going to be speaking about those two different diets. So yes, you say November 23rd. I mean, that's months away. Believe me, when you get to my age, it's going to be there like that. All right. It's just going to be there. It's around the corner. You haven't seen that yet? If you haven't, you haven't reached my age yet. Okay. All right. Next, to remind everybody that are already registered, we have Pilates that's happening on Monday night. That's a class that we're doing once a month. And I was told to let everybody know, and you'll get an email on it. But for whoever's on there on Monday night, so please have a hand towel with you. All right. What that's for, I have no idea. But just have a hand towel. You're going to need that as a prop. Also on the 18th, on Wednesday night, Damian Washington, Tyler Campbell, and myself will be on to continue with men's issues with multiple sclerosis. And of course, we'll talk about depression and things like sex. Oh boy, big topic. All right. And other things that just, affect men and not affect women. So women, if you're on there, well, that's great. But, the questions are not about those things down there. It's about our things down there. All right. So you can be part of that. Next Saturday, the 21st, I was supposed to be in Greenville, South Carolina, but guess what? COVID says no, or Delta says no. And so we're not going to be there doing an in-person program, but we are doing that program virtually. And that's with Dr. Mary Hughes and our Pilates instructor, who was going to be doing that live, but now she'll be doing it virtually for everybody, whether or not you're part of the class that we do with her. All right. And then the following week, we have mental wellness, we have yoga, we have other things. And then the month begins anew, and we're back to what we do every month. All right. Sorry, Cherie, I just had to bring all that out there right now. Okay, next. All right, so we got different people asking different things, and we are going to extend this a little bit because I do want to get through this. All right, Carla is asking, I saw her thing here. So many came in, I'm like losing where they all went to. Carla is asking, so agree to eliminate sugar and substitutes. Stevia and Trivia is good, she's saying. Do you agree with that, Cherie?
Yeah, they're more natural sweeteners.
Okay.
You can use things like those, or even honey or maple syrup as sweeteners instead of sugar. Those are more helpful. White sugar is very highly refined. Brown sugar is better than white. Molasses is better than brown sugar. So, because the refining process takes more of the nutritional value out of them.
Right. So Carla's continuing. She's saying it made a huge difference in her life. She's better now than when diagnosed 26 years ago, now that she's eating better. So she totally agrees with food ideas. And Klaus and dill pickles will help to cut carb cravings. Wow, that's a new one. Okay, great. All right. Thanks for that, Carla. All right. Mike is saying, oh, great. Thank you, Mike. Thanks again for another great program and information. Yes, thank you, Mike. All right, Tamina is back talking about sugar. Do fruits count in that category? Is it specifically for artificial sugar?
No, it's fruits that are sugars that occur naturally in your foods are fine. It's adding sugar to your foods that can increase the inflammation.
Okay, great. And Tamina, thank you very much for letting me know that I'm pronouncing your name correctly. Way to go. All right, next, Ruth. Ruth's asking a few different things, or saying a few different things. She was talking about, she was one of the ones asking about the Walls and the Swank diet. Like I said, I will be interviewing Terry Walls in November on that. And interesting, I wasn't diagnosed until I was 62. Okay, about all the diets. I'll watch future webinars. Good idea. And then you can bring those back to your support group too. All right, so that's great. Thank you for being here. All right, Denise, I got on this program. All right, she's the one that got on the program late. No Myelin Sheath tonight. You can come on to the program that we're doing next Saturday with Dr. Mary Hughes, and she'll answer your questions about the Myelin Sheath, okay? All right, and if you don't know how to get on that program, just go to the MS Views and News website, www.msvn.org. Look in the center column, and all the different programs are listed there. Or on the right side of the page, it says, register for programs, and you can find it there as well. All right, great. Next, who do we got next? The women, for the women that have those sex problems too. Yeah, I know they might, but that was a different topic. That was with a different speaker. That's for, I can't answer those questions. So if you have any questions about sexual problems for females, we just did a program. We had Karina Syracusa on, and we spoke about bladder issues and sexual issues. That was all on, and that is on our YouTube channel right now. So Ruth, or whoever just asked that, sorry, but you can go to our YouTube channel and check it out. And it's youtube.com/MSViews the news. All right, pretty easy to find. Or go to our website. You'll find a link from there as well. All right, next. I got so many comments here. It's crazy, right? All right, Ruth is asking about supplements. What supplements are beneficial for the aging process? Supplements and vitamins.
Yeah, really, if you're eating well, you shouldn't need to take supplements other than possibly vitamin D. If you've got a good, well-balanced, well-rounded diet, most of us don't even need a multivitamin. It causes expensive pee. Most of the vitamins are water soluble, and if you have enough in your system, you just end up peeing them out. So save your money. If you're feeling well, and you're eating perfectly well and well balanced, you shouldn't need supplements other than vitamin D to maintain your bone integrity and your central nervous system.
Right, thank you for that. Is eating organic better than eating regular crap?
Not necessarily. The people that are using the term organic are really, for the most part, growing very much like regular farmers are growing their food. It just may be, even with an organic farm, if you've got the farm next to you that's using fertilizers, that can waft over to your fields. So I would say you're paying more for equally good food. If you're getting fresh fruits and vegetables, just make sure you wash the crop residue off of them before you prepare them. Because organic, you realize, is fertilized with manure. So you have, you've got that animal waste there fertilizing your food instead of something that might not be quite as potentially noxious. So clean your food.
Oh, so I said what I said wrong. I said, what can you say about organic versus the other crap? Should have been the organic crap versus the other stuff. Gotcha. Gotcha. All right. So one last thing, hormone therapy for MS. Could you speak about any of that?
There have been clinical trials that have gone on and have not been followed through on particularly a product called estriadol. It's a hormone that is excreted during pregnancy. During the second, third trimesters of pregnancy, estriadol levels go up in women and their MS symptoms go down. It seems like they no longer have MS. Once those levels normalize and get back down to their pre-pregnancy level, maybe 3 months after delivery, a little bit longer than that if the woman's exclusively breastfeeding, then the MS returns to its normal level of functioning with the normal levels of estriadol. Obviously, that's not a drug that they have tested on men because it does tend to feminize. And it has not been as robust as we would like to think in the clinical trials as what we see in pregnancy itself. So hormones tend, we tend to have real bad PMS with our MS. Sometimes I think the hormone changes do impact the severity of your MS symptoms. And as we talked about earlier in the program, menopause tends to change the way that we perceive our MS with that change of hormones in our system. Men with MS, I read an article probably a month ago that they're seeing that men with MS now have lower testosterone levels than men without MS as a whole, which could be one of the reasons that erectile dysfunction seems to be more prominent in men with MS. But again, you've got your program coming up on that with Damien and Tyler.
Yes, but that is next week. But testosterone therapy does not help with erectile dysfunction. But testosterone therapy will help with endurance, will help to give you more strength, will help you cognitively and will definitely take away fatigue. So you can definitely look at testosterone therapy, guys, all right, not women. We don't want you to grow hair on your face. Oh, wow, I need to shave. Okay, that happened 1 day ago. No, I'm joking. Anyway, testosterone therapy is something that all men should be looking at, and depending on, your age, your doctor, you'd have to see a correct doctor for this. Don't just see any doctor, and your MS doctor is not really someone for you to see about testosterone or the hormone therapy for women. All right, so you just have to find another doctor for that. I think an endocrinologist can work with you on that as well. Is that correct? Okay. All right. So Cherie, Cindy wants to say, Cherie, you're a fab. I guess that means you're fabulous. I so appreciate your sense of humor and wealth of knowledge. Such a pleasure to listen and learn from you. Hey, what about me? Did I not make you laugh? Okay. Goodbye. We're done. I'm done. I can't take any more criticism. We had a great night, Cherie. Thank you for joining with us. Okay, and everybody that's been on this program, I do want to thank you. Please remember, go to our website, check out the programs that are coming up, get registered, all right? This program tonight was supported only by MS Views and News. This is something that I, as president, founder, and MS patient have wanted to do, by providing certain programs to the MS community, and so we do it, all right? Cherie, thank you again, and say hello to your husband.
Will do. He heard you. He says
Great.
hi.
Have a great night.